Well, February is officially National Children's Dental Health Month. I'm just learning about this as well, and who better to talk to than Dr. LaQuia Vinson from Riley Children's Health. Thank you so much for joining us today. We think about the pandemic, and then we think about having our kids go to the dentist. It's a little challenging for some of us, wouldn't you say?
It's a little challenging because definitely the processes and procedures have changed, but ultimately we are there to see our patients. So now you have your temperature taken when you come to the door, or there may be something more like a concierge where you call into the office, someone comes out to your car to greet you. Those are all things that parents have been willing and readily accepting with the changes that we've had to make with the pandemic.
Many parents are asking, is it safe to take my child to the dentist? What would you say to them?
It's absolutely safe. That's the one thing about the dental profession. We've always used a high level of PPE. Well, the only thing we've done with the pandemic is enhance the level of PPE that we're using. So instead of just a normal mask, we're using an N95 mask and likely a face shield as well.
When it comes to the conversations that you're having with parents nowadays, especially in the midst of the pandemic, what are some of the questions that you're getting?
Should we have been keeping our normal appointments this entire time? And the answer is absolutely yes. Dental health, we've discovered, has been one of the number one unmet needs during the pandemic, and especially with children. Dental caries is the number one preventable disease among children. So the fact that we've had all this, unfortunately, delayed care, we're pushing things further back when parents delay those preventive appointments.
Absolutely. I remember back to when I was going to the dentist as a kid, and I felt like the more I went, the more normal it became to me. So what are some of the things that you're telling parents? Make sure that you remember these things and keep it consistent.
Well, the number one thing is age 1 should be the first dental visit for all children. Waiting till age 2 or 3, we've discovered, is too late. So it's very important to establish that dental home early as possible. And then that way children have a lifelong love of going to the dentist and less fears as well.
That's awesome. There's so many things we could be doing, anything at home that parents should be doing with their kids to make everyone's job a little easier.
Definitely, since we're learning at home, our schedules may be a little different, but try to keep a consistent eating and snack schedule. What we don't want to do is get into habits of grazing. When we see grazing, we see definitely increases in dental caries.
It makes so much sense to me. I feel like I'm leaving this thing a little smarter than I came. Thank you so much for spending time with us.
Thank you for having me.